don't want this. I'll yield to my good friend from Wyoming.
Well, it's interesting because what you're really doing now is fundamentally talking about the core of the bill, the core that can't be changed as they drop this or add that. It's the core that led the dean of Harvard Medical School to say this bill, the core, is going to make spending worse. It's going to drive up spending, and it's going to not improve quality. So that this physician at Harvard has said people who are supporting this are living in collective denial. So it's no surprise that the American people are very skeptical, very suspicious. And it's why the dean at Johns Hopkins Medical Center just this past week wrote an editorial that said this bill will have catastrophic effects, and it will do more harm than good. And we're talking about the health care of the people of our country.
Well, Senator Yield, now those two deans are saying that the entire promises of this bill, that it would reduce cost and improve quality, both are not true?
That's what we're hearing from these deans of medical schools. It's what I hear at home all the time. People in Wyoming read this and they say, you know, this is wrong. This is going to make it harder for doctors to practice, harder for us to recruit doctors, harder for hospitals to stay open. But now you're seeing that not just we're saying in Wyoming. The Washington Post said it on Saturday. Medicare cuts could hurt hospitals, expert warns. We're seeing that affecting the quality of care. We're seeing it in terms of, will we have a doctor shortage? Will that worsen? We're going to deal with that at home. But people are seeing it all across the country because fundamentally, this bill is flawed. It will not address the sort of concerns that we have, and we are trying to get costs under control. This will drive up costs. We're trying to help improve the quality of care. This will not improve the quality of care. We're hoping to improve access for patients. This will make it harder. This will make longer waiting lines. This will limit people's choices. That will limit cares in the rural communities. I know about those in Wyoming. You know about them in Alabama. When we see and we read the report by the actuaries from the committee that oversees Medicare, and they didn't rush to do this. They're talking about the bill that now has been out, the 2,000-page bill that's been out for people to read for 3 weeks. It took them 3 weeks to do the report because they wanted to do a very thorough evaluation. And they looked at it and said, we think 1 out of 5 hospitals in the United States will end up closing within the next 10 years. And 1 out of 5 doctors will have to close their offices if this goes through. And this is what they're proposing. This is what the Democrats are proposing, something that is going to lead to 1 in 5 hospitals closing, 1 in 5 doctors' offices shutting doors, saying, we can't continue to keep the doors open under these circumstances. This report has said that the whole effort to drive down the costs of care is wrong. At its core, it's wrong, that the cost of care is going to go up if we pass this bill that is ahead of us now, regardless of the little changes they may make at the periphery. At the core, this is going to drive up the cost of care. At the core, it's going to cut our seniors who depend on Medicare for their health care. Medicare's going broke. This isn't going to in any way help that. It's going to make it worse. And then if they try to put more people into that Medicare ship that is already sinking, that's going to make it worse as well. Plus, the way that they try to solve this to say, well, we're going to cover all these new people. Many of them, the majority of them, are going to be put on Medicaid. Medicaid, a program that governors across the political spectrum have all said is a failed program, a program that is driving the states into bankruptcy, a program that governors call the mother of all unfunded mandates. That's a way they're trying to get the cost down by putting it on the states. Still the same people of America that have to pay those bills, whether you're paying your taxes here or there. Plus, they're going to raise taxes. This report from the Medicare Services Group looked at that and said, all of those taxes that are going to go up, $500 billion in taxes, well, of course those are going to get passed on. So people of all different income brackets in the United States, all people are going to get hit with those taxes. Some people may see a little benefit, but by 4 to 1, 4 times as many people are going to get taxed as people that are going to see any benefits. So we're looking at a program, a core fundamental of a bill that to me is fatally flawed, that will raise prices, raise insurance premiums for people that have insurance, cut Medicare, and raise taxes. And you say, how can people support that? We need a solution to improve quality, get costs under control, and improve access. This doesn't do any of those things. Plus, Plus, it starts collecting taxes, as my friend from South Dakota said, it starts collecting taxes in 3 weeks, but yet doesn't really give services for 4 years.
If the senator would yield, I was listening to you talk about this bill being fundamentally flawed, which it is. And I think back about the comments that Senator McConnell has made on the floor, and I think Orrin Hatch the other day from Utah expanded upon, but anything that is this major of a reform that we're going to live with for generations, it should be done in a bipartisan way. I know that Senator Hatch talked about the fact that something of this size should have 70 votes to pass a bill that will stand the test of time. And so earlier today, I heard some of my friends on the other side of the aisle talking about the fact that Republicans walked away, and I don't look at it that way, but I remember that very early on, when we saw the basic fundamental building blocks of this bill, almost every Republican senator wrote a letter to Senator Reid, our majority leader, and told him that if there were going to be Medicare cuts that were used to leverage a whole new entitlement, we could not support the bill. And so what did the majority leader and the finance chairman, Max Baucus, do? They used that as one of the fundamental building blocks of this bill. And so that's paying for 50% of this bill, is taking Medicare cuts, a program that is insolvent, and using it to leverage a new program. And so what I would say, and I see the majority leader here on the floor, number one, I agree that a bill of this size should have bipartisan support. I don't know how you get bipartisan support, though, when almost everyone in our caucus wrote a letter in the very preliminary stages of negotiation to let them know that we considered that to be a fundamental flaw. We considered that not to pass the common sense test, and yet it has been the major building block in causing this bill to come to fruition or to come to where it is today.
Well, the senator from Tennessee is entirely correct. We made a major effort. Senator Grassley and Senator Enzi, the two ranking members of the relevant committees, as well as Senator Snowe, were in endless discussions with the majority. And then it became clear that they were not interested in doing anything short of this massive restructuring of 1/6 of our economy, which includes, as you indicated, we expressed our concerns about early, this $500 billion cuts in Medicare to start a program for someone else. I would go so far as to suggest the reason the public's reaction to this has been so severe is because they have chosen such a partisan route. Had they chosen a different route, had we produced a bill in the middle, a bill much more modest in its intention rather than this audacious restructuring, the American people would see us behind it, and they'd be behind it. So by choosing this sort of narrow, my way or the highway approach, we're going to get to 60 votes and jam you, they have made it impossible to make this a proposal that they could sell to the American people, because the American people are not foolish. And the difference between this issue and most issues is everybody cares about health care, regardless of age. The older you get, the more you care about it, but everybody cares about health care. So they're paying attention. And they see that this is not in any way a bipartisan proposal. And so they have created for themselves not only a terrible bill that, in my judgment, should not pass and probably will not pass, but an enormous political problem for themselves along the way that would have been entirely avoidable had they chosen a different route from the beginning.
Well, and I think, the fact is that the two parties have certainly differences, and we're seeing that